In previous class, we studied drug adverse reaction, in which we studied number of factors which affect or which are responsible for the drug adverse reaction. These factors we studied one by one, and 8 factors we already covered in our last class. Now I'm going to start. That is factor 9. Factor 8, drug withdrawal reaction, that we already studied in our previous class. Sudden interruption of drug worsens clinical condition for which previously drug was used. Example, corticosteroids in asthma. It precipitates acute attacks, myalgia, depression, and acute asthmatic attack will come uh, whenever we suddenly withdraw the corticosteroids. Similarly, beta blockers, they cause angina and myocardial infarction. It also lead congestive heart failure, CHF. Now, next factor which is responsible for the drug adverse reaction, that is teratogenicity. Teratogenicity is related with a pregnant mother or fetus abnormalities. Drug which induce or which affect pregnant mother or fetus abnormalities. Earlier I told you thalidomide uh, tragedy in Second World War. It affect or it cause cocomelia, or it also cause this uh, false or uh, this hand and legs not developing in the fetus. Similarly, diethyl stilbestrol, it is commonly used as oral contraceptive, and it also cause carcinoma in the pregnancy, or it cause abnormalities. Valproic acid, it affect neural tube defects in fetus. Similarly, anti-thyroid drugs, it cause fetal goiter, hypothyroidism in fetus. Phenytoin, it cause cleft lip and microcephaly. That is a important drug adverse reaction which affect fetus or pregnant women. Drug can affect fetus at 3 stages. Number 1, fertilization and implantation, blastocyst formation, conception to 17 days, and failure of pregnancy. Cytotoxic drug and alcohol cause this, and it affect early 17 days of pregnancy. Now, second stage, the organogenesis process. It is in between 18 to 55 days of the gestation, and most vulnerable period Here you can see the maximum number of effect of drug to the fetus and pregnant women. Deformities are produced and teratogens occur. Third stage is growth and development and functional abnormalities. SE inhibitors are cause this type of adverse reaction. NSAID also cause non-steroidal anti-inflammatory drugs also cause premature closure of ducts and arteries. In these three stages, drug uh, so adverse effect in pregnant lady or uh, fetus. If any question or any doubt, you unmute yourself and you can ask. Risk category of drugs during the pregnancy, that is divided into A, B, C, D, E, like that. Pregnancy category, A category drugs. Description: there is no risk. Adequate and well controlled human study failed to demonstrate a risk to the fetus. There is no risk occur, like magnesium sulfate injection or thyroxine drugs. They are not directly affect the fetus or pregnant woman. Now this is no evidence of risk in human. B category drug. Animal reproduction studies failed to demonstrate a risk of fetus and no adequate and well-controlled study in pregnant women. Or animal study have shown the adverse effect, but adequate well-controlled study in pregnant women have failed to demonstrate a risk to the fetus in the any trimester. Trimester is a pregnancy divided into a three trimester: 3 month, early 3 month, mid 3 month, and last 3 month. Now the drugs penicillin, V, amoxicillin, cefaclor, erythromycin, paracetamol, and lidocaine. These are the safe drugs, or these drugs are not affecting uh, pregnant lady or in the pregnancy. These drugs given if required. Risk cannot be ruled out. Some drugs which have the risk, that is comes under the category C. Here we can see the animal reproduction study have shown an adverse effect on the fetus, and there are no adequate well controlled studies in pregnant women, but potential benefit may warrant use of the drug in the pregnant woman despite the potential risk. Examples are morphine, codeine, atropine, corticosteroids, adrenaline, thiophan, and bupivacaine. These are the drugs they are having risk to administered in any pregnant lady or pregnant woman. They affect mother as well as fetus also. Some D category drugs benefits may outweigh potential risk, that is positive evidence of human fetus risk on the adverse reaction data from the investigation or marketing experience of the studies in human. Number of studies show the evidence of risk in this category of drug, but Some due to some benefits, they drugs prescribed during the pregnancy if required with some risk. Example, aspirin, that is, uh, acetyl salicylic acid, phenytoin, that is anticonvulsant drug or anti-epileptic drug, carbamazepine, valproate, lorazepam, methotrexate. These drugs we can give in if required, but some risk is there. Contraindicated in pregnancy. These drugs completely avoid to in the case of pregnant lady. Uh, a study in animal and human demonstrated fetus abnormalities. There is a positive evidence of human fetal risk based on adverse reaction data from the investigation and marketing experience, and the risk involved in these drugs in pregnant women clearly outweigh potential benefit. That drugs are estrogens, that is sexual hormones, estrogens tablet, isotretinoin, ergometrin, and thalidomide. These are the drugs we are not prescribing in any condition to the pregnant lady. Now, next factor is uh, drug cause carcinogenicity or mutagenicity. First, you must understand what is carcinogenicity and mutagenicity. Carcinogenicity are the uh, agents which induce the cancer or which induce which make a changes in a cell to induce tumor formation or carcinogenic characteristic in a cell, and it become a in future it become a cancer disease. Now, carcinogenicity, the oxidation, reactive metabolites, structural gene damage. These are the drug, anti-cancer drugs, estrogens. They cause carcinogenicity, and mutagenicity is uh, the drug which changes in a DNA or RNA or genetic material in changes in a genetic material, DNA, RNA, or sequence, or some changes take place in genetic material, and which uh, further um, goes to the next generation. These type of drugs induce mutagenicity. You can see in next slide. Mutagenicity, the structural changes in DNA, the oxidation of the drug produce reactive metabolites, covalent interaction with DNA, inheritable, takes 10 to 40 years to develop this anti-cancer drug, and radioisotopes, they induce mutagenicity, usually marketed for the life-threatening conditions. These are the agents which induce mutagenicity. Now, iatrogenic drugs, drug-induced disease, or uh, drug which we are taking continuous, they uh, harm, they produce harm to our body. Some examples given here. If we are taking NSAID, non-steroidal anti-inflammatory drugs like um, ibuprofen, paracetamol, diclofenac sodium, uh, like this type of drugs we are taking, then it induces finally peptic ulcer in a stomach. Now, similarly, hydrazine, these induce DLE, that is uh, another disease which comes due to the continuous use of hydrazine. Phenothiazine, it causes Parkinsonism, and INH, that is isoniazide, it induces hepatitis, which is cause liver damage or liver cirrhosis. Now, some other drug administration, that is drug dependence. Use of drug produces a state in which person believe that continuous use is necessary for the state of well-being. That is psychic dependence, or to avoid withdrawal symptoms, that is physical dependence. Here, two types of dependence is given. One is psychological, and another is physical dependence. Psychological dependence. Here, person believe that a state of well-being achieved only with the action of drug. If I am not taking that particular drug, I am not feeling well. If here drug dependence is two type, uh, physiological and physical. Psychological and physical. In psychological drug dependence, here person believes that state of well-being achieved only with the action of drug. If I am not taking this drug, I am not feeling well. Like that feeling is person having, or he is uh, used to take that particular medicine for his daily routine work. That is depends. And similarly, physical drug dependence, that is here repeated administration of drug required to maintain physiological equilibrium, discontinuation or withdrawal which affect or which disturb his daily routine. Uh, Examples, alcohols, barbiturates, benzodiazepines, these are the drugs which cause physical dependence, and uh, if we stop this drug, it shows withdrawal symptoms to the body. Now, prevention of adverse drug reaction, avoid all inappropriate use of drug, use appropriate dose, route and frequency of drug administration, or take consideration of previous history of drug reaction, illicit or allergic disease or exercise caution, rule out possibility of drug interaction, to adopt correct drug administration technique, carry out appropriate laboratory investigation, be aware of interaction with the certain foods, alcohol or other household chemical. These are the some precautions we can take and avoid the adverse drug reaction. And this is not only our duty, our physician and pharmacist also take care about this thing to educate the patient for uh, considering his or her previous history or allergy condition or some drug idiosyncrasy or hypersensitivity uh, while the prescribing the medicine or while the administrating the medication. And patient also be aware about the uh, some household chemicals, alcohols, or food materials which are contraindicated with your medication. That is also helpful to avoid the adverse drug reaction. Now, management of adverse drug reaction. It is discontinue the offending agent uh, if you feel any drug adverse reaction. First of all, you stop the take medication or any material which cause the adverse drug reaction, that you stop or immediately you report to your physician. It can be safety stop. The event is life threatening or intolerable. There is reasonable alternative. Continuing the medication will be further exacerbate the patient condition. Continue the medication modified as needed. Uh, just I am giving you one example. In the case of tuberculosis, 5 first line agent directly administered to the patient, that is rifampicin, streptomycin, isoniazid, ethambutol, and pyrazinamide. These 5 drugs we are administering to the patient together in the starting. If patient not responding well to particular medicine, just rifampicin cause a very uh, side effect to the patient, or streptomycin it induce some side effect, then they stop that particular two medicine and they continue the medication with the three other medicine, uh, like I told you. So these type of medication we can't stop in between tuberculosis treatment. So we have to continue the medication along with to avoid the adverse drug reaction. That is a simple example. Discontinue non-essential medication, administered appropriate treatment of that particular symptoms or response, unappropriate response, to avoid that, uh, to give some antidotes like atropine, protamine, sulfate, dizibine, antibodies, flumazenil, etc. Provide supportive or palliative care. Example, hydration, glucocorticoids, warm and cold compress analgesic, and antipruritis, etc. Consider re-challenges or desensitization, etc. Now, some principles of descriptive toxicity testing in animals. That is some other portion which is related with adverse drug reaction. Here we study the effect of chemical produced in laboratory when properly quantified and applied to human beings. Exposure. Exposure of experimental animal to toxic agents in high dose, necessary and valid method to discover possible hazard to human beings. That is, we are doing on prior basis if drug going to circulate in human beings or administered or in the treatment of particular disease. Management of poisoning. Maintain vital and physiological function from impairment. Termination of exposure. Decontamination. जहां से भी आपको एक्सपोजर हो रहा है that particular medicine or that particular agents which cause adverse drug reaction. Prevention of absorption. Ingested poison. In case of poison case, a patient ingested the poison, the activate charcoal they are giving to avoid or to stop the effect of poison. Hastening or elimination, like urine alkalizer we are giving. Secondly, multi-dose activated charcoal. Extra corporeal drugs removal or particular antidote therapy. This is the management of poisoning. Now friends, today we are studying this much, and new topic I will start in tomorrow class. So please increase your strength in the class, and your seasonal is supposed to start in next month. So be prepared for that.